Hello, I'm Emily. I'm a staff nurse working in low secure forensic inpatient services. I'd recommend forensics because it's a really rewarding job role. You get to work with lots of different disciplines, OT, psychologists, assistant psychologists, support workers, engagement coordinators, activity coordinators, and we're all a really good team. We all work together really well. We do a lot of long-term work with our patients and we get some really good results.
I wanted to work on forensics on Ashley Ward because I was a student there since 2020 and I liked the way the pathway worked for prisoners and how to get them back into the community or the pathway back into prison.
So I was a prison officer prior to working in forensics, and I guess as a prison officer you can't be seen to be too caring, and I felt that was a bit of a tough role for me. And my friend's mum at the time was a nurse consultant here at St George's, and she was like, why don't you apply for this job? And it was a healthcare role. And I was like, oh, I'll go for that, and I got it. And then since being here I've gone from band 2, basically I did my nurse training, and I'm now currently a band 7, so I've done various roles within the Hatton Centre, and I've just got my dissertation to finish before I will be an advanced clinical practitioner. So I've had lots of opportunities whilst being here.
There's lots of training development opportunities and the preceptorship programme's really good, particularly the forensic preceptorship programme. We did a lot of resilience-based work and it helped the transition process from student nurse to newly qualified nurse.
Yeah, it's rewarding to see your patients actually when they've come across to you really, really poorly and you're working with them on a one-to-one and with your team around you to get them to a place where they can go into the community because they don't think they're ever going to get out there, and together you work together as a whole to get them where they want to be.
I think having key patients do like the long-term work, working alongside psychologists and senior members of the team, and everyone in the team really having different ideas, new approaches.
I feel massively part of my team.
Great, we're one big family. No, it is, it's really good, it's good.
Yeah. MPFT is very supportive. We get offered a lot of supervision and a lot of support from the team. Not only your managers, but doctors support you, your team support you.
I think they actually care about you. Personally, I couldn't have been supported enough by management on the ward, and actually above management that sort of went above and beyond to adapt for me, and having that sort of flexible working to help accommodate family life as well as working life. I think they've been really caring towards me as a working, and I haven't felt like just a number. And again, development, I've been able to progress, which in some areas you don't get that, and I just feel like MPFT have really looked after me. I've been here for 17 years in November, so I guess it shows if I hadn't have been looked after in that amount of time I would have probably have gone away before now.
I feel really valued and appreciated by the team. It's really rewarding and there's lots of opportunities.
Exciting, challenging.
We are a team, we are one, we are MPFT.
I'll say patient focused because it's always been remained patient focused with as part of the team, and it is enjoyable. I don't hate coming to work every day. I love the people that I work with and I like the patient group I look after.